Pathology of gouty arthritis. If there is any hyperuricemia, if hyperuricemia, precipitation of urate crystal in joints, there is precipitation of urate crystal in joints, activation of complement and kinin system, neutrophil chemotaxis, and of crystals phagocytosis of crystals by the neutrophil, phagocytosis of the crystal by the neutrophil, and these neutrophil release the LTB4 prostaglandin free radical, which again go in the presence of chemotaxis. As for chemotaxis, they again accumulate there, and the cycle actually continues. Then there is lysis of the neutrophil and release of the lysosomal enzyme. So hyperuricemia, precipitation of the urate crystal, activation of the complement and the kinin system, neutrophil chemotaxis, phagocytosis of the crystal by neutrophil, there is lysis of neutrophil, release of lysosomal enzyme. And on the other hand, there is phagocytosis by macrophage, release of interleukin 1b and other cytokine. There is release of protease, and these accumulating effect, like release of protease enzyme, release of lysosomal enzyme, and release of leukotriene, prostaglandin, and the free radical, causes tissue injury and inflammation. If we talk it again, hyperuricemia, there is production of the urate acid crystal in the joints, and activation of the complement kinin system, neutrophil chemotaxis, phagocytosis of the crystal by neutrophil, lysis of the cell, and release of the lysosomal enzyme. And there is phagocytosis of macrophage, release of the interleukin 1b, and release of the protease, and ultimate effect, release of the lysosomal enzyme and release of the protease, thus causing tissue injury and inflammation. That is gouty arthritis.